Hello, this is Nurse Chioma, and in this channel, I talk to you all about nursing news, healthcare news, special updates that's going on in the nursing world, NCLEX updates, NCLEX preparation tips. I do also like to sprinkle in a little bit of information that related to your health. So for those of you that are general public that want to learn more about ensuring or improving with your health, I also talk about that as well. So, and if you just want to learn more about myself, this is a great place to start. So go ahead and hit the subscribe button for this channel so that we don't miss out on our videos. Turn on the notifications, and I'll see you in today's video. Alright, so now before we get into the video, I do want to share with you one of our partners, which is Picmonic. Picmonic is an amazing tool for those of you that are currently either nursing students, medical students, you're in school to become a physician assistant, anything in the medical related field. Picmonic is a great website that will help you to get started, help you to better understand the material, the content in a way that's more visual and very colorful. So if you are somebody where you like visual cues, you like things that are really colorful to help you to better remember or understand the content, then you're going to want to check it out below. You can actually get started for free if you check out the link below this video. All right, so now that's it. Let's get into the video.
So we're going to talk about, and this is going to be lesson one, we're going to talk about how to beat pharmacology, all right? Because pharmacology is one of the number one weak areas for a lot of people. So we're going to talk about studying the suffixes, types of medication questions, dosage calculations, as well as narrowing the answers. And this is a separate strategy though. And so we're going to talk about this to help you know how to study for this area. So, and this is going to really help you for those of you who weak area was pharmacology. So let's first start with studying the suffixes. So one thing I talk about is when it comes to studying for pharmacology, to study about the suffixes and the rationale and two side effects. So I'm going to go over with you those ones in detail. That's what we're going to go over with right now. So there are 25 main suffixes of classifications of drugs that's normally tested on the exam. And every suffix is associated with a rationale and side effect. So hopefully you remember that its significance and the importance of studying in this matter. So let's first talk about the first one. So there's several, but this is going to really help you group your studying, and you can definitely take notes as I'm talking. Don't feel like you have to write down each of them, but I mean you can or you cannot because it's already given to you, but this is just going to help you to begin to be aware of these things. So the first one I want to go over is thrombolytics, all right? Thrombolytics. So this ends with ACE, A-S-E. And it's important that you understand the difference between thrombolytics and anticoagulants. It's not the same thing, all right? We don't give thrombolytics in the same situation as we do with anticoagulants. So with the thrombolytics, the ending is ASE, and what this does, it dissolves clots. So clots that are already formed, okay, that are already formed, and we give it to dissolve it. So an example of this where this occurs is somebody who has had a stroke, all right? So, and there's like a window time to when we give this actually, because there's also some severe side effects that can occur. One of them is severe bleeding, all right? Severe bleeding, and it's supposed to say abdominal cramps. Severe bleeding, either abdominal cramps or abdominal pain. Severe bleeding, those are what the side effects are. Because remember, anything that what it's doing is to, like whatever it is doing, the side effects is what is going to be what will be worse if it overdoes that rationale. So the purpose of this is to dissolve a clot that's already formed. So if we're not careful, the patient can it can dissolve it so much that they go into severe bleeding. So a good example of this would be strep tase. Strep tase. And remember, it's when they just had a stroke. So not where it's been, 5 years, they had a stroke, they have history of CVA or something. That's not the same situation. They just had a stroke, and now we're going to give them strep tase. Okay? So with thrombolytics, it dissolves clots. It doesn't prevent clots. That's the biggest thing. It's not the same thing as anticoagulants because it dissolves clots. All right, and then there will be another point where I'm going to go over anticoagulants so that way you can see that it's not the same thing. Now, antifungals, all right? Antifungals, the suffix for this is azole, A-Z-O-L-E. And with antifungals, what they do, they treat fungal infection. I'm going to tell you right now, it's with antifungals, it's usually, oftentimes when we give it, it's like a topical treatment. Sometimes it's like a powder, it's like a cream, and a lot of the fungal infections are related to skin. So that's the reason why the side effect is rash and burning. Okay, so like for example, and a good example of this would be meconazole. One thing I'll say is that sometimes some of the fungal infections we'll see is it's in between skin folds, okay? Like in between skin folds. So we'll put this medication to help to relieve the infection. So this will be common with somebody who's overweight, and we'll put it in there. And then, but the side effect though is that it can cause rash and burning. Rash and burning. All right. And the example of this is meconazole. Okay, so now we're going to move on to types of medication questions. Types of medication questions. So when it comes to the types of questions, the questions they'll often test you with side effect related answer choices. So where the choices are actually the side effects, and that's why I said you have to know the two side effects. And then also the other type of questions is dosage calculation questions. These are typically how the exam will test you when it comes to pharmacology. And one thing I'll say too is that pharmacology, as far as the NCLEX RN exam, it usually covers about 14% of the exam, and which is actually pretty high. So that's why it's important to know the pharmacology well. A lot of nurses say that that's their weakest area. So it's important to know the pharmacology well. So like I said, you must study at least two side effects, not just one. And then you should start to learn what is the intervention of that side effect. You should, when you think of the rationale and the side effects, okay, what would I do if that happened, right? What would I do if that happened? So for example, when you look at drugs, where it lowers the electrolyte value, you need to know the appropriate intervention and whether, for example, you would intervene it with maybe food, diet, or maybe a drug. So let's say, for example, one EKG rhythm that you should also know is torsades de pointes. Torsades de pointes, which is associated with hypomagnesium, which is where the magnesium level is low. Once again, you should know what the normal magnesium levels are too when you're preparing for your exam. So if it's the magnesium, if they're having hypomagnesium, then the appropriate intervention for that is to give magnesium. That is the intervention. Is to give magnesium. So sometimes it will be food, sometimes it will be another drug. So it's important for you to understand that when it comes to, the interventions with the side effects. So, and some side effects may be related to food interactions. We're going to cover that right now, what I mean by this. So, as we mentioned earlier, Lasix. So what does Lasix do? And the other name was furosemide. So Lasix, it causes the patients to lose potassium, right? It causes them to lose potassium. So therefore, you need to know what food replaces potassium. Because I'm telling you, the exam, it doesn't, one thing you'll realize about hopefully, that you'll realize about the exam is that it doesn't give you, I don't want to use the word tools, it doesn't give you the details. It assumes that you know the details. And that's why, a lot of nurses get thrown off because they weren't expecting how specific it would test them. And this is what I mean by this. I'll show though as we move along. But so you need to know what food replaces potassium. So here are the foods that replace potassium, and make sure you know this. Also, when you you may get questions where it will ask or it will mention like food trays. What's on your patient's food trays. You need to identify what food sources are on there that may be rich in potassium or low or whatever it is. So the first one, cantaloupes, very high source of potassium. Very high source of potassium. Next one are lentils. Lentils. That's also really good source of potassium. Bananas. And bananas is, bananas for me, even people who aren't nurses know that bananas are high in potassium. So I usually tell people, make sure you know other sources like the ones I mentioned right now, because the exam most often is not going to give you bananas. Like it's not, it's not going to make it that easy. So but bananas are high source of potassium. So we're going to talk about, and this is going to be lesson one, we're going to talk about how to beat pharmacology, all right? Because pharmacology is one of the number one weak areas for a lot of people. So we're going to talk about studying the suffixes, types of medication questions, dosage calculations, as well as narrowing the answers. And this is a separate strategy though. And so we're going to talk about this to help you know how to study for this area. So, and this is going to really help you for those of you whose weak area was pharmacology. So let's first start with studying the suffixes. So one thing I talk about is when it comes to studying for pharmacology, to study about the suffixes and the rationale and two side effects. So I'm going to go over with you those ones in detail. That's what we're going to go over with right now. So there are 25 main suffixes of classifications of drugs that's normally tested on the exam. And every suffix is associated with a rationale and side effect. So hopefully you remember that its significance and the importance of studying in this matter. So let's first talk about the first one. So there's several, but this is going to really help you group your studying, group your studying, and you can definitely take notes as I'm talking. Don't feel like you have to write down each of them, but you can or you cannot because it's already given to you. But this is just going to help you to begin to be aware of these things. So the first one I want to go over is thrombolytics. All right, thrombolytics. So this ends with ACE, A-S-E. And it's important that you understand the difference between thrombolytics and anticoagulants. It's not the same thing. All right, we don't give thrombolytics in the same situation as we do with anticoagulants. So with the thrombolytics, the ending is ASE, and what this does, it dissolves clots. So clots that are already formed, okay, that are already formed, and we give it to dissolve it. So an example of this where this occurs is somebody who has had a stroke, all right? So, and there's like a window time to when we give this actually, because there's also some severe side effects that can occur. One of them is severe bleeding, all right? Severe bleeding, and it's supposed to say abdominal cramps. Severe bleeding, either abdominal cramps or abdominal pain. Severe bleeding, those are what the side effects are. Because remember, anything that what it's doing is to, like whatever it is doing, the side effects is what is going to be, what will be worse if it overdoes that rationale. So the purpose of this is to dissolve a clot that's already formed. So if we're not careful, the patient can go into, it can dissolve it so much that they go into severe bleeding. So a good example of this would be strep tase. Strep tase. And remember, it's when they just had a stroke. So not where it's been, 5 years, they had a stroke, they have history of CVA or something. That's not the same situation. They just had a stroke, and now we're going to give them strep tase. Okay? So with thrombolytics, it dissolves clots. It doesn't prevent clots. That's the biggest thing. It's not the same thing as anticoagulants because it dissolves clots. All right, and then there will be another point where I'm going to go over anticoagulants so that way you can see that it's not the same thing. Now, antifungals, all right? Antifungals, the suffix for this is azole, A-Z-O-L-E. And with antifungals, what they do, they treat fungal infection. I'm going to tell you right now, it's with antifungals, it's usually, oftentimes when we give it, it's like a topical treatment. Sometimes it's like a powder, it's like a cream, and a lot of the fungal infections are related to skin. So that's the reason why the side effect is rash and burning. Okay, so like for example, and a good example of this would be meconazole. One thing I'll say is that sometimes some of the fungal infections we'll see is it's in between skin folds, okay? Like in between skin folds. So we'll put this medication to help to relieve the infection. So this will be common with somebody who's overweight, and we'll put it in there, and then but the side effect though is that it can cause rash and burning. Rash and burning, all right? And the example of this is meconazole.
Hi, hello, welcome. Thank you for watching this video. My name is Nurse Chioma. I'm the founder of Choosing Nursing over at choosingnursing.net. We're here today to help you to succeed in your journey towards becoming a nurse. Today I'm going to be talking with you about how to study for pharmacology, and I'm going to be doing a live demonstration as well with my supplies. So if you want to learn more about pharm, you want to get stronger in this area, and you just want to understand how to study this, then definitely watch this video and stay tuned until the very end. Make sure you also comment below and let me know what city, state, or country that you are listening from today, so that way I can welcome you. If you're watching this on the replay, don't hesitate to also say hello. Don't be shy. On the replay, we also obviously or definitely appreciate you for watching on the replay. If you're not already, you can also download my free guide. I have a free guide which is called Top 10 Biggest NCLEX Mistakes That You Must Avoid. And whether you took an exam before or you took an exam before, or if this is your first time, it's definitely going to help you. So that way you can identify, you can learn what are those common mistakes that you
you may or may not be making, so that way you can be prepared for the test, and that way you can be successful. Okay, so come on in, say hi, comment below so I can make sure that you're listening. If you like the video, heart the video. It also lets me know that you are there. And I'm gonna go ahead and share this video as well. So give me one moment so I can also share the video. And I'm gonna show you some visual aids today as well, so you can get comfortable. This is a requested topic, so I wanted to do this. So let me see if I can get started. Don't see any comments yet, so let me make sure that's working. Okay. Hello, come on in. I can't see your comments yet, so I'm just gonna give it about a minute. Okay, I can see the comments on here. Oh, for the free guide, type the word NCLEX in the comments. I forgot to say that. If you want the free guide, type one word. The word is NCLEX in the comments, and that's how you'll get the guide today. All right. Can you guys see me okay? Do I look clear? All right. Thank you so much. Hi from Florida. Hello from Florida. Welcome. All right. Can you guys see me okay? Yes. All right. Okay, let me put this up. Okay, there we go. Hey, I'm so glad you guys joined. I'm glad that you guys are here. All right, and if hopefully what I said yesterday, for those of you that watched yesterday's video, encouraged you. All right, let's see. Okay, all right. So yeah, so that's the first thing. If you want to get the guide, type the word NCLEX in the comments, and then once you type the word, then check your Facebook inbox, and we will send you the link through your Facebook inbox, so that way you can download the guide today. The second thing is we do have a class that's coming up. So this is going to be our 3-day live online content review class. The class is going to be done by myself, and we're going to be going over pretty much everything you need to know on the exam. We go over all the 8 categories on the test, starting with physiological adaptation all the way to basic care and comfort. If you want to take a look at what we cover specifically hour by hour, day by day, you visit our website under the live reviews page, and you can see exactly what we go over. For those that register for the class, you will not only get you not only be able to attend live, where you can ask questions live and get your questions answered, but you also be part of the Facebook group. You're also going to get access to the replay of the class for 6 months. And in addition to that, you will also get our Solid Steps 3.0 program also for 6 months. And another bonus is that you'll get our Body Systems Crash Course. And this is a course that focuses on anatomy and physiology, so that way you can get the foundation of the anatomy and the physiology and how that connects to the test. So you can really just be well-rounded, all right? So we decided the class was originally scheduled to be in 3 weeks, but we decided to move it. So instead now it's going to be held on January 30th, 31st, and the 1st of February. All right, so we moved it to the last weekend of this month to give us more time and to give you more time. So January 30th, 31st, and the 1st, to register for the class, it's $497. But if you register by Friday, you can be a part of the payment plan, and the payment plan is 4 weekly payments of $127. So if you want to get the payment plan option, please go to please make sure you join our email list, and then we're going to send you the link for the payment plan option. If you want to just register for the class, you go to bit.ly/3-day signup .choosingnursing.net bit.ly/3-day signup .choosingnursing.net. Put it in the comments at the same time. Okay, and then for those of you that asked about the one-on-one tutoring, if you want one-on-one tutoring, or you want to talk with me on the phone, or you want some type of private tutoring that's more customized, that's more personalized, just simply go to NCLEXPrepSuccess.com. All right, NCLEXPrepSuccess.com. If you're looking for more of a personal tutoring or one-to-one support in any way. All right, so I think those are all the announcements. If you are ready, put ready in the comments, and we're going to go ahead and get right into it today. And we're going to talk about how to study pharmacology. So if you think this is information that somebody else could find valuable, please don't hesitate to share the video as well. Okay, all right. So how to study for pharm. So the reason why pharm is difficult is because there's so much subsections to understanding pharm. You know, there's so many aspects to learning pharm. So it's you got to know the the drugs. You got to know the side effects. You got to understand how to give the drugs. You have to understand what drugs cannot and cannot be given. You got to understand the route, right? You have to be familiar with IV drugs, for those that are RN test takers, versus PO medications. You got to be familiar with so many different aspects of pharmacology, and that's why it can feel overwhelming or exhausting. But it really stems down to how organized you are. Okay? It really just stems down to your ability to organize when it comes to this area. So what I'm going to do today is that I'm going to give you some blueprint and some guidance so you know exactly what it is that you need to focus on, right? So that way you can be organized, and that way you can retain this information and learn it really well. Okay, so here's the first one. This is number one. You want to create a pharmacology table, all right? Create a pharmacology table. So the best way to organize the fact that you have to be aware of so much aspects of pharm is to create like a table. And you organize the table into specific sections, specific categories. That's the best way to learn this without feeling too overwhelmed. So I'm going to show you an example of a table that goes, and this is a table that obviously is not going to cover everything, but this table does go over some key components when it comes to drugs. So over here, oh, you know what, I realize you're not going to see this very well because of the fact that it's small, the ink and everything. But this is common drugs these are common drugs that we give on the floor, okay? These are common drugs that we give on the floor. Can you kind of see that? So in here, the way that it's organized is that you have generic drugs, because the thing about the exam is that the exam tests you primarily on generic medications, not the brand or the trade name. So you need to know the generic. So we have on this side, let me see if I can move this a little bit. On this side, we have generic. This side, we have the brand name. Here we have the rationale. Here we have the route. And then here we have the side effects. Okay? So this is the generic name, the brand, the rationale, how do we give it, and the side effects. So for example, over here, you can't read it, but I'm just telling you what it is. On this side, the generic is like hydrocodone, ibuprofen, insulin, levofloxacin, levothyroxine. Those are all generic names. And then here we have the brand name. So Norco or Vicodin, Dilaudid, right? Motrin, Humalog. Those are all the brand names. And then over here we have what it's used for. So pain, more pain, fever, high blood, hyperglycemia, and etc. Then over here we have the route, okay? And then here we have the side effects. I'm going to see if I can just push this in a little bit so you can take a look. I know it's backwards, but just take a look anyways. Okay, all right. Okay, so I'm just showing you an example of how to get organized. All right, and then on this side, these are cardiac medications. So this side, these are common medications, but this side is mainly cardiac drugs. All right, so this is good because then what happens is that it helps to get you organized, and it exposes you to the medications that's commonly seen on the test. You want to know what drugs are common on the exam? The drugs that are common are the ones that we commonly give on the floor. Okay, those are the drugs that you're going to see on the test. They will still ask you some rare and random drugs, but the ones that you see on the test is the ones that's predominantly given in the hospital, right? Those are the ones. Those are the ones that are given in acute scenarios. When the patient is having chest pain, when the patient is having pancreatitis, when the patient is having upset stomach, when the patient's going to have surgery, when the patient's coming back from surgery, right? So this is why you have an advantage if you've been exposed to like the hospital setting, because then you can already be aware of what the medications are, just all a matter of studying the details. So, so learning, what's the generic name, learning what is it used for, learning how do we give it, learning the side effects. If you look at this closely, which you can't see very well, but if you look at this closely, okay, it lists several side effects for you here, all right, and they're highlighted and everything. So I'm one of those people where I like to highlight, I color coordinate, I notarize everything. It just helps me learn, and you have to be aware of how do you learn best, right? So the one of the important things too is that these, like on top of this, so this is organized based on the generic, the brand, what it's used for, the route, and the side effects. And then in yellow are the drugs that are fall risk. So let's do a quick pop-up question really quickly. I'm gonna say a list of medications, and then you tell me of the list I say right now, which of these would be considered high risk or high fall risk. Lisinopril, metformin, morphine, and simvastatin. All right, one more time. Lisinopril, morphine. What did I just say? Oh, I already forgot. Okay, lisinopril. Sorry. Oh, yeah, there we go. Lisinopril, okay? Metformin, morphine, and simvastatin. Which of those 4 medications are considered a high fall risk? Okay, so let me list them on here in the comments. Lisinopril, morphine. Oopsie, let's put it like this. Metformin and simvastatin. All right, what do you think? Which of these 4 drugs would be considered? Because I know it's not possible to see it because of the camera. Okay, good. There you go. Okay, I see. Yeah, the morphine, right? Why would the morphine be a high fall risk? Because morphine, what does it do? It helps to treat pain, but then at the same time, it can make the patient dizzy or lightheaded because we're giving them a narcotic, right? So the answer is morphine. Okay, the answer is morphine. You may be thinking lisinopril because it helps to lower the blood pressure. It helps to lower the blood pressure, but it's more of a daily type of medication, so it's not gonna just suddenly drop the blood pressure. Morphine is the highest risk out of all of them. All right, so morphine would be the biggest concern, right? Because it's a narcotic, and narcotics tend to lower the blood pressure. They tend to make people more lightheaded, dizzy, It can cause orthostatic hypotension. That's the reason why. Okay? So the better that you can organize your table, the stronger you're going to be when it comes to pharmacology. So for example, to organize your table, there's several things you can do. You can either create something like this from scratch, and everything. On our website, we do have a farm cheat sheet, which breaks down like hundreds of drugs, but then also different parts of the medications that you need to be familiar with. But you can write it out on a piece of paper like this, or you can do it on your computer. All right, you can do it on your computer. You can organize it into a table. Another thing you can do is that you can create flashcards. So you can get flashcards either in person, the one that you get at the store, and write it out. Or, I talked about this yesterday, you can download an app and create the flashcards online. So Quizlet, it allows you to, just create the flashcards super fast. Or you can use another one I recommend. I'll put it on here actually. Quizlet, all right, or Chegg flashcards, okay? So those are some ways. And when you create the cards, what it does, it helps you to create separate decks. So that's one thing that I would do, is that I would create separate decks, and then I would put, okay, these are pain medications, these are insulin medications or medications for diabetes, and these are cardiac medications. I remember we actually do have like a free farm flashcard set that I created. I don't remember it off the top of my head right now, but if I find it, I'll share it later this week. All right, so that's one way. You can create it. You can go on a paper, write it out, and you can say like this, or expand it bigger. You can get online flashcards, or you can create notes. You can get a PowerPoint slide or Microsoft Word, and just organize it, whatever works best for you. Okay, whatever works best for you. Or get notes from a friend, all right, whichever works for you. Okay, so organize your table, that's number 2. In fact, let me put these points in the comments before I forget. Okay, there we go. And then number 2 was to organize it. Okay, and then here's number 3. So there are 3 main ways that I recommend to study pharmacology. Okay, there's 3 ways. The first one, or 3 methods I should say. The first one is that a lot of people do, is you can study them individually, right? So individually means that you literally go through one drug at a time, right? And study it that way. It's the most accurate, but it's the most time consuming, all right? So individual is most accurate, but most time consuming. Okay, that's what most people do, but that takes a long time, to be honest. The second way, another way that's actually also really good, is to study by the systems, by the body systems. Okay, so what I mean by this is, okay, now what you're going to do, you're going to organize them into each body system. So you have cardiac drugs, you have endocrine drugs, right? You have respiratory drugs. This is a really ideal way to study if it's been a long time since you graduated, all right? If you struggle with retention, or you just want an easier method, body systems is very, very helpful, okay? Because it helps you to organize it, and it's easier to remember, right? It's easier for me to remember all the drugs associated with the respiratory system versus for me to remember one drug at a time, right? So so when you organize them by systems, it improves your retention skills, all right? I'm going to share the last one, and I want you to tell me, or I want you to decide, which one you're going to choose moving forward when it comes to studying pharmacology. The third one is by classifications. Okay, classifications. So what I mean by that is, let me see, do I have that on here? Okay, no, I don't. So classifications, so ACE inhibitors, ARBs, fluoxetins, aminoglycosides, that's classifications. So the thing about the classification style is it helps you to learn a lot in a more broader way. Okay, so for example, what I would do is, let's say I'm learning about beta blockers, right? So beta blockers, they all have the same rationale, they all have the same side effects, right? So instead of me trying to learn individually atenolol or individually metoprolol, I just need to know that it's beta blockers and they all end with OLOL. And they all purpose to lower the blood pressure, right? And all of them have the same side effects, which is to lower the heart rate, bradycardia, or it can cause more of a respiratory problem in patients who have an underlying respiratory disease, right? So you see how easier that is? So if you're going to do the classification style, that means your focus is you're trying to learn groups of drugs, all right, groups of medications, really effective given the fact that there's so many drugs to learn. So even for example on this guide, I would group all the insulins, into one category. I would group all of the ACE inhibitors. I would group all of the oral hypoglycemic agents, right? So the classifications is a grouping style. And so you can actually do more than one of these methods, but try and pick one that's the predominant one and then just run with that. So some people do, okay, the body systems and the classifications, or some people do the individual and the classifications, or just one or the other. It helps if you struggle with pharmacology, if you struggle with retention. Okay, is this making sense so far? We got some water. Okay, I hope this is making sense so far. Okay. It's on here too. All right, here's number 4. This is the 4th one. All right, let me know if you're following along, if you're still there. I'm sure you're probably just taking notes. If you're listening, make sure you like the video, heart the video, or share, so I know that you are, that you're still there. Okay. Okay. Here's the 4th one. Here's number 4. You need to learn. I want you to learn the mechanism of how the drug is given and what physiological process interferes with it. All right, so learning the mechanism of the drug and what physiological process is it interfering with. So what do I mean by that? Okay, you're familiar with ARBs, right? Like ARBs and everything, which is angiotensin 2 blockers. So the best way for me to understand this is for me to understand what it's doing in the body. So there's a hormone. So here's a good example. There's a hormone called angiotensin 2. All right, there's actually more than one. There's angiotensin 1 and angiotensin 2. Angiotensin 2 is a hormone that causes the blood pressure to go up in the body. So patients who have hypertension, they release more angiotensin 2, which causes their blood pressure to go up. So what ARBs are, they're pretty much angiotensin 2 blockers. So they come in and they block, they put like these, they're literally like the receptor sites. They block the receptor sites from attaching to the angiotensin 2, which causes the blood pressure to go up. All right, I'll say that one more time. ARBs, which is like Sardin, like Cozar, right, Losartan, those type of drugs, what they do is that they're stopping the release of this hormone called angiotensin 2, which is responsible for making the blood pressure go up in patients with high blood pressure. So when you learn, by learning the physiological process that's associated with that drug, you know the why, and now you understand. You're able to memorize it better because you understand what it's actually doing. Does that make sense? Let me know if that makes sense or not. All right. So let me know if that makes sense. That's one of the things, is that if you can understand the mechanism, then you'll understand exactly how it works and why it works and why we give it, right? Because if you know why we're giving it, then you're going to know when it's inappropriate to be given, right? And that will help to do what? Increase or improve your critical thinking skills. All right? Okay. I hope that what I'm saying is, maybe you may have to listen to it a couple of times to really understand it. But are you still there? Are you following? I don't see any comments yet, so all right. Hopefully what I'm saying is not too confusing. Okay. All right, here's number 5. It's on here. Here's number 5. Learn side effects versus adverse effects. All right, learn side effects versus, okay, you're following. Okay, great. Learn side effects versus adverse effects. Okay, so so side effects and adverse effects are two different things. Okay, side effects and adverse effects are two different things. Side effects is where it's an effect that we anticipate the patient to have. That's what it is. It's something that we anticipate them to have. But an adverse effect is deadly. It's fatal. Okay? So side effect, we're not going to stop giving the drug necessarily because of the side effect. But if they show signs of the adverse effect, then we would. So let's think of a really good example. Metformin, okay? Metformin. Actually, no. Let me give a better one. Going back to the Lopressor, okay? So Lopressor, the side effect is bradycardia, right? But an adverse, the side effect is bradycardia. And an adverse effect would be they go into like respiratory arrest, right? Or they begin to show signs that their respirations are decreasing. That would be that would trigger us to stop the medication. So anytime you're learning this stuff, you have to think about, and this is what the exam wants you to know, what is my intervention? What am I supposed to do? Because here it is, the NCLEX exam is testing you on what you do, not what the doctor does, right? So when you're learning all this stuff, one of the things that people leave out when they're studying is that they forget to think about how the nurse would respond, what the nurse would do. So their focus is, memorizing and learning side effects and learning adverse effects. But then they don't stop to think about, well, what would the nurse do if that happened though, right? How is it different for one over the other? So you have to always ask yourself, what would I do, right? If you ask that question when you're learning this stuff, you'll be more likely to think critically, and you're more likely to pass your exam because you understand the difference. Okay, so that's one of the biggest things, is that side effects is what I would anticipate. Adverse effects is deadly. Here's another good example: vancomycin. All right, vancomycin is an antibiotic. All right. The side effect for vanco is upset stomach, right? They have, they'll complain of diarrhea, they'll probably have an upset stomach. That's a side effect, right? But that's not enough for us to stop giving it though, right? We can just say, okay, well, I'll talk to the doctor about giving you something for stomach, but it's not an adverse effect. An adverse effect would be more like they go into anaphylactic shock, or they begin to develop like rashes. I've seen patients like that where some of them, they were on the Vanco, and then they got like all these boils all over their face, all these rashes all over their face, and we realized it was the Vanco. So we had to stop giving the Vanco and try a different antibiotic. So you have to, think about, would I stop this? Like, how would I respond? Because they have one over the other. Because they still need the antibiotics, right? They still need the antibiotics. But is this enough for me to tell the doctor, we need to stop giving the drug, So always think about the difference between how you treat of one over the other. Okay, all right, the last one. All right, this is the last one. Is to learn medication administration. All right, learn medication administration. So let me show you. So this is the part I'm going to show you now. This is the demo part. One of the things that people miss with pharm is that they struggle with application. Okay, so the application process is a challenge for a lot of people, like they don't understand how we give it, right? So they're, you're learning the rationale, you're learning the side effects, you're learning the, the treatment, but it's still not clicking with how it's actually given, like how it goes from being a drug to being in the patient's body, like how you give it. So what I'm going to do today is I'm going to do a demonstration of giving IV push medication. All right, an IV push. So there are some it's not all medications that you can give IV push. All right. IV push is normally given over the course of 2 to 3 minutes. Okay, only over the course of 2 to 3 minutes when we're giving IV push medications. And when we give IV push medications, you need to also, wash your hands. Depending on what the drug is for, you may need to check their vitals before you give it. So if I'm going to give digoxin as an IV push, I need to do what? First we need to know their digoxin levels. And then second, I need to know their heart rate before I can give it, right? Another example, if I'm giving Lopressor, there are some cases where we may give Metoprolol IV. If I'm giving that IV, I need to know their heart rate before I give it, right? Because I'm giving it for the blood pressure, but if their heart rate is too low, then I can't give it then. It's contraindicated. So an IV push is when we want to administer something that will work within the next 5 minutes. So blood pressure medications, diuretics, protonics, these are all good examples. Not antibiotics. You don't give antibiotics as a push. All right. So remember, this is given over the course of 2 to 3 minutes. So you don't need gloves because it's not really a sterile procedure. But I have the gloves anyways. And there's a couple of things you would need. We're gonna pretend that this vial here is the medication, okay? So let's say this is my protonics. Meds can come in different ways. So it may be where it's like a powder and then you shake it up first and then you're gonna give it, or it may already be a liquid like this. A lot of times they come now in this powder type, and then you shake it up, and then now the drug is dissolved. It helps to preserve the medication. This in real life, if you take a look at this, right? This is just water, okay? This is only sterile water, but we're pretending like this is protonics. Why do I give protonics? Why would I give my patient pantoprazole? Well, let's see. It's on my table. Okay, so now I'm using my table. Okay, so right here, okay, pantoprazole, which is the generic name, and the brand name is Protonix. It's used for stomach acid. A better way that we know to use it is to prevent ulcers. All right, to prevent gastric ulcers or duodenal ulcers. And patients are at risk for an ulcer if in the event they're under a lot of stress, right? They're in the hospital, they were in an accident, all those things can put them at risk for an ulcer. And if they're in the hospital for an ulcer on top of, the trauma, on top of the pancreatitis, then they're going to be in the hospital longer. So we normally give the Protonix as a prophylactic, all right, not as a treatment. Okay, it's usually a prophylactic. So this is my Protonix, for example. Then I'm gonna have my syringe. Okay, this is a 3 millimeter syringe. Okay, and then, this is my 3 millimeter syringe, and then this is my needle here. And then I have some flushes here. Usually I like to have at least 2 flushes. All right, when I'm doing this procedure, and then I have some alcohol as well. So what I would do, I would first go into the room. Okay, so I'm gonna go into the room. I'm gonna introduce myself if I haven't already. I'm gonna wash my hands. I'm gonna say to the patient, you know what, the doctor says that you need your Protonix because of whatever reason. A lot of times when we give Protonix, we give it early in the morning. Okay, early in the morning before meals. All right, so you have to remember that step. We give it early in the morning, like around 6 a.m. Okay, so in the hospital setting. So here's my Protonix. So I'm gonna do what? I'm gonna scan my medication. I'm gonna scan the patient, right? Scan, verify. What's your name? Your birthday? Great, awesome. Okay, what's the amount? Verify the amount. Usually it's gonna be the whole thing. So then I'm gonna go ahead and grab my syringe and my needle. All right, so I'm going to put this together. Okay. I may have to just do it like this way though. I'm not gonna do the whole, like take the thing out and everything. Well, I'll do it though. Okay, so I'm gonna hook this together, all right? Okay, and then I have my Protonix here, for example. So I'm gonna go ahead and take this off, all right? So let's say I'm gonna get my alcohol, just wipe it down a little bit. I already shook it ahead of time before I started. And then I'm going to, what I do is I mix it. So I will, get some from here, and then I may mix it. So maybe I'm gonna give 2 milliliters. So I'm gonna take this out, okay? And then I'm going to go ahead and I'm gonna, with this is different. You don't need to do the whole, let me withdraw air, all that kind of stuff. You don't have to do all that. All right, so I'm gonna go ahead now and I'm gonna put the needle in. Okay, and then I would flip it over and then I would pull back. All right, and I'll pull out. And now for this vial, you can see it's like, this is like a whole 20 mLs, but there would only be about 2 mLs in here. All right, so let's say I'm doing it in real life, and the amount that I'm gonna give is 2 mLs. Okay, so take a look at it right now. What number is it on? What number is that on? 1.5, right? Right, that's 1.5. So I'm gonna pull everything down, and we are there. All right, so let me put it like this. It's at 2 mLs. You see that? Turn like that, because it's right on the thing. That's why. 1.5. The dark black is 2, and then 2.5. So now I'm going to go ahead. All right, and I'm going to go ahead and after I would first make sure the line is patent. The line would be, let's assuming that it's already patent because the patient's getting IV fluids. I would clean the port of the patient's IV and everything. So take my alcohol pad out, clean their port, wipe it really good and everything. And then I would take off this, all right, take this off, and then I would push it, okay? So what I do in real life, you wouldn't. I'm just doing this for the sake of the demonstration. You wouldn't take it off with your hands like the way I just did right now. You wouldn't do that. You would instead use. You see this safety cap right here? You push it against a table, and then it will cover the needle. Okay, it will cover the needle, and then you take it off. All right, then you would take it off. Okay, so then now I have my medicine in here. All right, I have my medicine here. Let me see if I can get that. Well, I have my medicine here, and then I would go ahead and push my medicine, and I would push it over the course of, about 2 minutes. Okay, and that's it. And I gave the medicine. Your patient should not have any symptoms while you're giving it. Okay, they should not be complaining of chest pain or anything. It should just feel like nothing. It should feel like, they may say, oh, that feels cool, like a water flushing. That's good. We're in the vein. Here's one thing. You need to verify that the IV is paid in before you give the medication. Because if you push this med and you didn't verify it first, then you just wasted medication. And then now you have to go back to the pharmacy, not the pharmacy, your drug dispense, and get the med all over again and do the process all over again. And oh, that's so tedious. That's the thing about being a nurse, is that you need to learn quickly. You have to save time right then and there. Otherwise, you're going to go back and forth. All right, so that's it. Okay, that is pretty much the process. All right. Oh, did I put this here? That is pretty much the whole process when it comes to medication administration today. All right, and how to study pharmacology. I hope that what I said was helpful and everything, especially showing you the demonstration. If it was, comment below. Let me know that you found this information helpful. Share the video or tag the video. Yeah, and then if you want to get that guide I mentioned earlier, it's called, type the word NCLEX in the comments. Once again, we are having a class, and the class has been moved to the end of this month, which is going to be January 30th, 31st, and the 1st of February. It's 3 days. I'll be teaching the class. It's online, and when you register, you'll immediately get access to this the link for the class and everything, and you'll get access to the replay recordings, the Facebook group, some bonus courses as well. And then we're only having 2 3-day classes this year, just January and February. For the class, the registration is $497, or the payment plan option is 4 weekly payments of $127. You have only until this Friday. After this Friday, the payment plan won't be available. So we'll be emailing you out the link if you're on our email list. If you're not on our email list, then make sure that you simply just go to bit.ly/3-day signup.choosenursing.net to sign up that way, or just simply inbox us and we'll send you the link to register for the class. All right, thank you for being here. I'm glad that it was helpful. I'm glad that you found it helpful, and I'm glad that you found it helpful. So have a wonderful day, and I'll see you the next time. All right, bye-bye.
Hi, hello. So we're going to talk about how to master pharmacology with flying colors inside of this training. So if you have been in a position where maybe you've been discouraged, frustrated, overwhelmed with the medications, this is going to hopefully help to bring some clarity and begin to give you, the necessary tools so you can really grasp pharmacology, right? So you can really understand pharmacology in a way that makes a lot more sense to you. And, as I'm teaching, I want to encourage you right now to put aside all forms of distractions. You know, I know this is a video, but I want you to go ahead and put aside anything that could distract you, anything that could take your attention away, because this is important, right? This has to do with your career, right? This has to do with your ability to get to the next level, right? So put aside anything that could distract you from really paying attention close to this video. And I want you to come in with no expectations, all right? I want you to come in with the mentality of, you know what, I tried things before, I struggled before, but this is the time where things can really begin to change for me, right? So I want you to have a different perspective and really receive what I'm going to go over with you in today's training. Okay, so we're going to be talking about how to master pharmacology, you know, really with flying colors. And one thing I can truly understand is that when you're in this situation, you've probably been through some challenges with learning pharmacology because it feels overwhelming, right? Like it feels really overwhelming, learning all the medications. It feels like, you know, how am I going to learn everything? Where do I even start? What do I do first? How do I cover it? Why am I not remembering it? You know, like just, it can feel very overwhelming and almost kind of frustrating, especially when you've been trying a number of different things to help you. And so this is totally normal. And I'm going to give you 3 steps. Yes, 3 steps that is going to show you literally starting today, literally how you can really master pharmacology in a way that is clear, is precise, and truly, honestly, even makes sense to you. So let me go and pull up. I'm going to share with you in my screen really quickly here so you can take a look at this. So the first thing is that you're trying to figure out, okay, where to get started, what to cover, how to review it. And one of the biggest mistakes that I see a lot of people make is that you're actually studying the medications individually, right? So you're literally, what you're trying to do is that you're trying to go through the medications one by one. And that's why it's taking you a long time. That's why it's taking forever to learn the medications, because you're really literally trying to do it one at a time. So here's the reality, is that you need to create a framework of how you're going to learn information. Okay, you got to create a framework, right? So, and what I mean by a framework is literally a structured blueprint to learning the medications, not one at a time. Because if you do focus on a one at a time approach, it is going to take you a really long time to really know all the medications. So and it really depends on what you've tried before or how you learn best. But there's a few ways that I recommend. The first way, number one, is to learn the medications, and you can group them into different systems. You know, so for example, you have cardiac systems, and hopefully you're taking notes. You have cardiac medications, you have respiratory medications, you have GI medications, right? So if you can group them, if you can begin to group them into their different systems, that's a strong way, especially if it's been a while since you learned this information, if it's been a challenge learning it. Sometimes studying by grouping them into different systems of the body helps you to, you know, make that connection so you do remember it. Another way, aside from what you're doing right now, is that you can honestly break it down into classifications. Okay, so I'm going to show you, in a minute too, I'm going to show you a picture of literally, like, when it comes to the classifications, what you can do. So classifications would look like, you know, you have certain groups of medications, and you have, for example, beta blockers, you have fluoroquinolones, you have your calcium channel blockers, right? So instead of trying to learn the drugs one at a time, you instead can group them individually, right? You can put them into those groups based on the classification. And so what this does, versus you studying them one at a time, right? Versus you going through them one at a time individually, what this will do is that it will help you to learn more medications because you're grouping them into their classifications. So for example, and classifications have more than one drug included in them. So for example, beta blockers, right? So a good example of a beta blocker can be Lopressor, also known as metoprolol. Instead of you spending all your time learning one individual beta blocker, you're going to learn the group of the beta blockers, and you're going to learn what are the rationales, what are their side effects, and that will help you to learn more medications. And the second thing that you want to do is that once you do this, then you want to identify what is the 2 side effects, okay? What are the 2 side effects that will help you to, that goes along with that medication, okay? So you want to learn the classification, and then you want to focus on 2 side effects, okay? 2 side effects. Because for example, if I am learning beta blockers and I'm focusing on only learning one drug at a time, such as if I'm learning only Lopressor, which is also called metoprolol, if I learn that only versus if I learn, okay, what is the suffix ending, actually, I should say, what is the classification, which is the beta blockers, then I'll know more drugs, because beta blockers includes metoprolol, atenolol, right? So if I can remember the classification name, then I'll be able to be aware of more drugs because I'm learning a group, right? So you want to identify the rationale plus 2 side effects. And pay attention to respiratory or cardiac side effects, right? That's what's really going to be really important, is your respiratory or cardiac effects the most, because sometimes some medications or some groups of medications can have multiple side effects, right? And typically when it comes to nursing care and patient care and taking your exams, you need to be aware of the most critical effects, right? The effects that can cause the most damage, right? The whole body is significant, but the effects that can really immediately have the most damage. So if that drug or that group of drug has respiratory or cardiac effects, those are essentially important for you to be aware of. Okay, so here is an example of like a diagram that can help guide you when it comes to organizing the drugs into different groups. So in this example I'm showing you right now, this is literally showing you on one side the classification, right? And it's giving you an example, but it's giving you the breakdown. So at the top you have the classification, right? So the name of the classification, and then you want to identify what's the drug name and or prefix or suffix, right? Because that will help you to associate the drugs. That's what you need. If you're struggling to retain information, you have to look at ways to associate it with something that you already understand, so it's easier to remember. So the drug name, the prefix, and then you learn the rationale. Okay, so what does it do of that classification, and then you learn the route, and then you learn the side effects. Okay, so for this image showing you right here, a good example here is your fluorokinolines, right? That's the name of a classification. And then you have levofloxacin, all right? Fluoxetine, that's the drug name or the prefix. And then you have the rationale. So what does it do? It's an antimicrobial antibiotic, right? So it pretty much treats infection. And then what is the route? Route is very important because if you can give the medication, if you give the medication the wrong way, you could kill the patient. So you do need to know that. That's very significant. So this group of medication, you have IV piggyback, or it can be given orally. And then the two, like I said, 2 side effects is that it can cause GI upset or central nervous stimulant effects, right? So effects involving the brain. Okay, so this is an example, and you see how this is much more organized versus you trying to go through a book, versus you trying to, like learning the drugs one at a time. But now from this image, you can master one group of medications like that. And now it's more simplified. So for me, this is kind of like creating almost kind of like a hierarchy or a funnel or a pyramid, but actually opposite, and that will help you. So that's one of the biggest steps I really highly recommend when it comes to learning the medications. Okay, so that's one of the things that's really, really important, is that you want to begin to create that framework. And you're creating that framework, and that's helping you to get organized, right? Because you have to have a pattern first before you get started. Then the next thing, so that's the first step. The next thing, now you have step number 2. So step number 2 is that you want to identify and know what are the core fundamentals to pharmacology. Okay, you want to learn the core fundamentals. There are, for every topic, every content area, there's always core fundamentals. And the issue for you, what you may be experiencing, is that you're not looking for the fundamentals. You're not looking for the patterns. And because you're not looking for them, that's why you feel like you're all over the place. That's why you're struggling. That's why it's not clicking. That's why you're not retaining it. That's why you're not registering the information, because you're not looking for, okay, what are the principles? What are the things that this always stands for pharmacology, right? What are the things that's always set in stone? What are the things that I need to, that literally helps to lay that foundation, right? To understanding the medications, to knowing the whole picture. Because pharmacology is more than just knowing one drug at a time. So when it comes to the core fundamentals, I'm gonna lay them out for you right now. All right, so hopefully you're still taking those notes, okay? So the core fundamentals you're looking at here is, you gotta know the drug rights, also known as the rights of the medications, right? So that's really important. Originally it's 5 rights, then it's literally gone all the way up to 10 rights. But it's important that you understand not just the rights because of what they are, but you have to understand the rights so that way you know what component is missing when you're looking at questions, right? Because what component is missing, what component is essential when it comes to NCLEX questions, right? Or nursing questions or pharmacology questions. The second thing is drug administration, right? So now that I understand, okay, what are the different rights when I'm giving a medication? Because the different rights, what it does is that it's helping you to reduce medical error, which is what's really important. And the exam, nursing is all about identifying if you're really competent, if you're safe, which is why the rights are important. So then now you need to know how to administer the drug. So one of the challenges for a lot of people is that you're trying to memorize it without understanding it. You know what I mean? Like, you're trying to memorize it without truly understanding it. If, for example, if I have to administer something, and let's say I need to give my patient some type of medication, and if I have to administer this medication, so here I have for you a little sterile water saline. So when I'm giving a medication, let's say I'm giving a powder medication, when I administer it, I'm going to grab a syringe and I'm going to take some water from this syringe, and this is sterile water, and I'm going to mix the medication, and I'm going to administer and push it slowly over the course of, let's say, 2 to 3 minutes. So me understanding the steps of how I actually give the medication that helps me to retain it. That helps me to remember it better versus if I'm only just reading it by myself from a textbook, right? So this is one thing that's really important, is that if you feel like you're struggling with pharmacology, you're not giving yourself enough connections. You're not necessarily looking at how the process actually works, right? For example, the same thing with giving insulin, right? If I mix insulin, I need to know, not just memorize the steps, but if I need to literally see the steps. I need to literally understand why I'm going to give this, pull this first and give this next and do this in this way, because that influences my ability to make the connection. Right? Yes, of course. If I'm administering insulin like that, I need to check the patient in 15 minutes. I need to look for hypoglycemic signs within the next 30 minutes to an hour, because you understand what you just gave. So that's one of the things, is that you're trying to learn it, but you're not really focusing on the step-by-step administration process. The third thing is drug precautions. For every drug that you give, you should be aware of what are the precautions. So meaning that, okay, what is at risk for me giving this medication? And then what are the parameters? What are the contraindications? What are the lab values? What are the allergies, right? What are the things that I should check or do before I give this medication? Precautions, right? So when you're learning drug after drug after drug, you're not just learning it to memorize it. You want to think, okay, how does this relate to me as the nurse? Right? How does this influence, right, what I do? Okay, I'm going to give the patient a medication that's going to thin their blood. I probably should check their PT, their clotting factors before I give it them, because of the effect that drug is going to have, right? So you're looking at the whole picture. That's what you're doing. Then the drug effects. So you got to know the therapeutic effect, which is the desired effect, the side effect, the adverse effect, right? So the therapeutic effect is what we want to happen. The side effect is what could potentially happen, that's not a desired effect. And the adverse effect is life-threatening. So when it comes to medications, you need to know, here's the part about nursing now, you need to know not just what each of the effects are, but how do you respond differently based on the effect. So if they have a therapeutic effect, naturally, of course, we just continue to monitor, right? Or if it's a therapeutic effect, let's say the effect is we're giving medication to lower the blood pressure and it brings the blood pressure down, right? That's the therapeutic effect that we wanted. So now we continue to monitor. If it has a side effect, side effects can be expected, but it doesn't always mean that we should stop giving the medication. That's a very important mental note. You don't have to stop it, but because it's often expected. Okay, giving a beta blocker, a side effect is that it will cause the heart rate to go down. So a precaution would be to check the heart rate before I give it. Versus adverse effect means that you have to stop giving it immediately and you need to let the doctor know. So therapeutic, I measure the result, I don't do anything. Side effect, I am aware of it, and as long as it doesn't cause the patient distress, there's no need to intervene. Adverse effect, you do need to intervene. And then last but not least, drug interactions. Okay, so drug interactions is going to include like food and drug interactions, for example. So being aware of, okay, can I crush this med? Can I not crush this med? What foods should I educate the patient not to consume because they're on this medication? What foods can literally cause the medication to work better or to work worse? right? Also, another type of interaction. So you have food that are interactions. You have other drugs that are interactions. And then also herbs, 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 right? Because sometimes patients may take natural herbs and sometimes they can interact with the medication that they're on. So educating them on that is also important too. And your awareness is important with that too. Another type of interaction too is based on the patient's ethnicity, right? Because some patients, because of their ethnic background, they're more predisposed to either have a worsening effect or a different effect because they're on that medication. This is what I mean. It's like literally you're looking at these core fundamentals. And so now what happens is as you begin to pay attention to each of these fundamentals as you're learning, while implementing the framework, it will begin to click. It will begin to register. It will begin to make more sense to you. You'll feel less overwhelmed, right? Because you understand the core fundamentals. All right. So I hope what I'm saying so far is, really hopefully grasping with you and, making more sense to you. Okay. So this is the next thing, is that, and on top of doing the things that you're doing now, in order for you to know the medications and memorize the medications, understand the medications, you have to begin to learn the medications in your most appropriate learning style. Okay? In your most appropriate learning style. So sometimes what you're doing is that you're spending a lot of time reading, which is great, but you fall asleep, right? Or you go through it and you forget it, and you spend all day at the library or something. And you're not registering, is this really is this my most appropriate learning style? Is this really the learning style where I always resonate with information the most? Because that's how you save more time, right? If my learning style is really, more kinesthetic and I'm over here just reading, no wonder it's taking me so long to remember the information, right? No wonder it's taking me so long to process it. No wonder it's so hard, because you're not matching what you're learning in your learning style, right? You may be making it harder for you than needed because of the way that you're actually learning it. So so as we know, there are three main types of learning styles, right? You have audio, right? So hearing, and then you have visual, right? So seeing a picture. And then the third one is that you have video, or actually, I'm sorry, kinesthetic. Okay, so kinesthetic, which is literally where you're doing more movement, right? So more movement, that could be writing things out, right? That could be something that's more interactive for you, right? So the thing that I want to really emphasize and stress the most, after you identify your learning style and how you're going to implement this into your studying, is honestly, when it's stronger if you use all three, right? So if you're predominantly auditory and you listen to stuff, which is great, you'll be more likely to retain information faster and easier and quicker if you literally begin to use all of them at the same time, right? If you can implement a method where you're doing audio and visual and more kinesthetic, like it's more likely to grasp with you. That's why I think about the reason why people travel, right? The reason why people do certain things is because they want the memory, right? They want the experience, because it's hard to forget, good or bad. It's hard to forget an experience, right? An experience is what causes you to remember stuff. And so when you're reading all day or doing whatever you're doing, in the past so far to study, there's no experience. right? There's no true experience. You're just going through the information. You're just going through the motions. And that's why it's not sticking or staying with you, right? So it's a lot stronger if you can honestly incorporate all three when it comes to your learning style. Okay, so this is one of the things, is that the way that you've been approaching it, it can seem simple, but then you have to think about, okay, what am I doing and how can I be more effective, right? What is it that I'm doing? And then how can I honestly be a lot more effective, so that way everything clicks, everything makes sense, everything is simplified for me, right? So the thing I want to really hit home to you is that you have to create a simplified structure to learning pharmacology, right? Otherwise, you're going to continue to struggle to pass in this area, right? You got to really sit down and buckle this stuff down so it can be smooth for you, right? So it's not something that's so hard or challenging for you. So you have to really focus on a simplified structure when it comes to learning pharmacology. Otherwise, you're going to find yourself still struggling, still trying to remember it. I don't know if you're aware of this, but did you know that the third leading cause of deaths in the United States is medical errors? That's the third leading cause. So what that should tell you is, what it should honestly tell you is that if it's difficult for people who are already trained medical professionals who see the medications every single day, then by far it's going to be more challenging for you to acquire on your own the first time, right? For you to learn the drugs on your own, it's going to be a little bit more difficult, right? It's like literally you have to work your way up a uphill to really grasp the medications, right? Really get that momentum. And that's just so, I remember when I learned that stat, I was like, wow, that is so shocking, to know that that's literally the third leading cause of deaths, So here's the thing. This is the thing, all right? So in order for things to really shift for you, so that way you can, experience something brand new, so you can go to a different place than you are right now, I want to really gently help you, right? I want to help you to understand pharmacology in a way that is crystal clear to you, right? In a way that's going to really make sense to you, in a way that's going to really help you. Maybe it's been a while and you've tried a number of different things and you don't know what to do differently now. So here's how I can really help you to better understand pharmacology. So about once a month, I am going to be teaching, actually starting this upcoming month, I'm going to be teaching a class that's coming up, okay? And this is going to be a 6-hour pharmacology review class that's going to help you to finally really understand pharmacology, okay? So what I'm going to do through this class that's going to be, very unique, very different, is I'm going to literally show you my framework in depth, right? So if you appreciated the one I just showed you earlier, I'm going to show you my framework in depth so you can start learning pharmacology within the next 21 days. Because it takes 21 days to master anything. But you're going to be able to really grasp it, really understand it, really know it in the next 21 days, right? Where now people are going to be asking you, what does this mean? What is this, right? Because you understand the medications so well. Right? So I'm going to help you to better understand pharmacology and really show you, what is the step-by-step that you need to incorporate, that you need to implement, so it can really, truly, honestly make a lot more sense to you. And what's going to happen is that you're going to walk away through this training with clarity, right? You're going to walk away with clarity. You're going to, and really know how to understand the medications, right? So this is really going to help you to better understand the medications, really help you to better grasp the medications in a way that makes sense to you. Through this training, we're going to review over 206 medication classifications broken down in a way that you can finally grasp. All right, so we're going to go over a lot of medications, and these are not just random medications. These are medications that are seen over and over and over again when it comes to your exams, when it comes to pharmacology review. Like, these are medications that are predominant, that are essential, that you need to know, because they're based on disease processes and disorders and conditions that's frequently seen in the healthcare arena, in the hospital, in the emergency room. Right? So we're going to go over in depth during this powerful 6-hour training that's going to really help you, in such a strong way, so you can really grasp it, really understand it. And what I'm going to do, I'm going to break down the medication administration for you. Okay, I'm going to really break it down, because I know sometimes you need more steps, you need more walkthrough. So in the training, we'll break down insulin administration. We'll break down giving multiple dose administration, because those questions are often the drag and drop questions. Those questions are also often select or apply questions, right? Those are usually the most complicated questions. But in this training, I am going to break it down for you, so you don't. So you're not wondering. Also, as well, I'm going to show you how to calculate drift factors and dosage calculations. It's not hard. Literally, I have people who go from, oh my gosh, I have no idea how to do this, to when the class is over, they know how to do drift factors and dosage calculations once the class is done. So you're going to walk away understanding, because I know it can feel so frustrated and complicated and hard. I'm going to show you how to plug in the calculations, how to plug it in, how to set up the equation, how to compute it correctly every single time. I'm going to show you the formulas when it comes to drift factors and dosage calculations. This is one of the reasons why we have medical errors. This is right here an area that a lot of people struggle with, but you're not going to struggle with it once you go through this training. Okay, it's going to make crystal clear sense to you by the time you are done. So we're going to go over that in the class. It's going to be so good, so life-changing for you. And also, we're going to go over the core fundamentals, right? As we're going through the medications, we're going to actually go through the core fundamentals, because and this is going to include therapeutic effects, side effects, adverse effects, right? That way you're not guessing or wondering how to learn them. What do I do? How do I learn them? Right? I'm going to break it down for you during this class. Okay? It's going to make crystal clear sense to you. All you have to do is just show up, right? And put in the time and the energy. Right? But it's going to be crystal clear to you as you're going through this class, right? And that's why I'm so excited, because I know you need somebody to, walk you through and to handhold you and kind of really show you the rope when it comes to this. The next thing too is that we're also going to incorporate visual aids to help you to learn the information more easily, right? So maybe visual is your thing. In the class, I'm going to show you and I'm going to help you break things down, and because we're going to have visual aids throughout the teaching. So I'm going to even show you right now, actually, the actual slides from the class, so you can see them. Like some of the slides, I'm going to just run through them really quickly so you can see them. And let me see if I can just hide my face for a second. So I'm just showing you, these are not even all the slides really, but literally we're going to go over strategies, we're going to go over medications, we're going to break it down. You're really going to understand it, and it's going to be so much easier. It's going to be grouped for you and throughout the class. We're going to go over immunizations and drugs and pain medications and just a number of even like doctor's orders here as well. We're just going to go over so many medications. oh my gosh, we're going to really cover it. And it's going to be great because versus you spending, literally spending hours and hours and hours going through the medications on your own, and it takes you weeks, it takes you months, to put it all together, right? To formulate it like that, you need to spare your time, right? That can be exhausting, trying to put it all together, trying to piece it all together, trying to figure out, okay, maybe I should put this next or this one no, it's all given to you right in the class, right? That way you don't have to waste time doing all that stuff, right? And it's so easier, right? So easier. And it's something that actually works, right? Because we've seen so many people that have been so successful, finally moving on to the next level because of this teaching. And this is what this will do, because you're in this class, we're incorporating all 3 of your learning styles, right? So that way you can learn the medications a lot faster. You'll be able to attend this. And here's the thing, you're going to attend this live, right? So that way you can ask me your questions, right? You can ask questions live, so you're not in the dark or confused as well. And here's another thing too, when it comes to this class, we're going to review important keywords, okay? Important keywords. So what I mean by this is that, you have to, when it comes to the sake of the test, like, you got to understand keywords, okay? When it comes to nursing, when it comes to pharmacology, keywords are so essential, because it really makes a difference when it comes to your ability to think critically, okay? So inside the class, what I'm going to do, I'm going to go over keywords with you, okay? And I'm going to also review different strategies for pharmacology questions, especially if you don't know the question, right? Because it can definitely happen where you're going through it, and you don't really understand, well, what do I do if I don't know the medication? I'm gonna show you that in the class. All right, I'm gonna really break it down for you. And then if you don't, the reality about this, I want to really point out to you, and I'm sure you already know this, but if you don't pass pharmacology, right, not only does it affect your confidence, but especially if you're in nursing school, you can get kicked out of your program. You can experience challenges and find yourself in the same position and not progressing to the next level. If you don't pass, right, if you don't get to that point where you move on and you understand and you get through pharmacology, and because especially if you're taking the NCLEX exam or you're taking certain types of tests, the reality is that a lot of these exams, they're usually the highest area on the test. All right, the highest area. So if you don't pass pharmacology, you can experience delay in passing these exams. And what that will do, that delay will keep you stuck in the same job you are working right now. The same job, not moving forward, not progressing, right? Not experiencing more in your life that you deserve. And it's your time, right? Pharmacology is so essential to getting to the next level. So that's one of the things I really want to hit home to you, is that you want to focus on, okay, how do I get to that next level? And it's going to be through this class. So I want you to join me, as well as hundreds of other people have taken this class as well, and sign up and register for the class. What you can do, you can go to the link below to apply to attend. What I'm going to do is I'm going to actually give you to join the class, okay? This is going to be mind-blowing. So the value. Hello, in this video, I'm going to be talking with you guys about the next generation NCLEX exam, as far as helping you to better understand how to take the test, how to prepare, how to pass your exam, so that way you can get your license with confidence. So stay tuned, watch this video until the very end, and we're going to go over it today.
All right, so we're going to be talking about the next generation NCLEX test, and what I'm going to do with you guys, I'm going to go over and show you screen by screen, and I'm going to essentially show you like how to better understand the test and prepare for the exam, especially if you're not feeling very confident about the exam. And I'm going to give you some pointers, and I want you to really honestly listen really well, because I know that many times when people are taking the test, they feel overwhelmed, scared, and etc. And all sorts of emotions go into place. But you honestly, as you're listening to this, listen really intently and try your best to take some really good notes, okay? So we're going to go over this today. So I'm going to be going over with you. I'm working on a book right now, actually. We're going to be going over the next generation NCLEX in a lot more detail in this book. This is what the cover of it currently looks like. I'm probably going to change the cover, to be honest. But I'm currently working on this book right now, which is going to be dedicated to the next generation NCLEX. So I have some of the book is ready. And what I'm going to do actually is I'm going to go over with you guys some parts from the book. And I'm going to talk into more detail as well, so that way you can really better understand the nature of this exam. So first, let's go kind of into it. Let me see if I can find the correct screen for you guys. Okay, let me go to the very first chapter. Okay, here we go. All right. All right, so here's the thing about the test, and it's not as hard as you may be thinking that it is, although it can feel like it is, but it's honestly about the way you comprehend the material and that you understand kind of like a sequential order to learning the diseases, understanding the drugs, and making sure you get the big picture. If you don't really get the big picture, then this is going to be hard. So what I'm going to focus on right now is specifically pharm, and just kind of understand a little bit more about pharmacology. So here's one of the things, the next generation NCLEX questions for pharm, it's going to assess your understanding of one, drug classifications, medication administration, adverse reactions, and patient education. One more time, drug classification, medication administration, adverse reactions, and patient education. You may encounter questions that require you to identify potential drug interactions, assess medication effectiveness, or prioritize nursing interventions related to pharmacological therapies. All right. Once again, you may encounter questions that will require you to identify potential drug interactions, assess medication effectiveness, prioritize nursing interventions related to pharmacology therapies. So here's some things that will hopefully kind of make this a little bit simpler. The first thing is, one of the things I always tell you is that the exam is trying to make sure that you are a safe nurse, okay? So essentially what you have to go in with the mentality is the test wants to see if I'm safe, if I can take care of a patient and keep that patient alive essentially, but the exam wants to see that you are a safe and competent nurse. Not that it wants to trick you, not that it's trying to, give you very evading questions, but instead you have to have the mindset that it wants to see how safe you are as a nurse. And so you have to pick answers that demonstrate you understand why you're giving a drug, what is the potential adverse effects from giving that drug, and what would make you say, no, I shouldn't give this drug. No, this drug will have X, Y, Z effect on this type of patient. So when you're learning the drugs, these are the things you have to be mindful of, so that way you can recognize this on the questions. What are drug interactions? Drug interactions are going to be what type of meds would conflict, right? So like what type of meds would conflict with that medication that they're already taking? That's one thing you have to think about. So let me write this here. What are drug interactions? Okay, so these are going to be what type of meds would conflict with what they're already on or what they're already taking. And then also this could also be herbs or herbal medicine or supplements. So you have to also be mindful of if the patient mentions, or even if they mention their ethnicity, because sometimes the test will mention the patient has this ethnicity in order for you, and it wants to see if you recognize common medical practices in that ethnicity that may contraindicate any medications that they're on or going to be on. So what are the drug interactions? What would conflict with this drug or another drug, right? When the patient takes the medication, what would conflict? For example, if they are, let's say the patient is on Coumadin, okay, let's say the patient's on Coumadin, and the doctor also wants to put them on another blood thinner medication, such as, well, usually that's the number one medication that we usually give patients on. But let's say they're taking Coumadin, they're taking warfarin, and so then we're also concerned that the patient recently was in some type of accident, or we're concerned that the patient is going to start taking, I want to say it's either garlic or ginkgo biloba. And those type of herbs, when taking it together while they're also on Coumadin, can affect the potency of Coumadin. So these are some of the things you have to think about. Medication effectiveness as well. This is going to be how well is the medication working? Is the medication giving the ideal therapeutic effect? Right? The reason why we gave it is to do X, Y, and Z. Is it producing that ideal therapeutic effect? And so there are usually certain parameters or certain signs and symptoms that we look for to identify this. So for example, if it's a blood pressure medication, right, it's effective. We know it's effective if the patient blood pressure becomes to the normal limits, right? We gave it because it was out of normal, and now it's within the normal limits. Pain medication, we gave them a pain med, and so now as a result, after giving it, their pain is reduced or gone, right? Those are simple examples of medication effectiveness, okay? And then as well, the other thing too is to be able to prioritize nursing interventions related to pharmacology therapies. So one common thing that you'll have to prioritize is monitoring specific lab values, right? So there's specific lab values that some meds you need to be more mindful of, right? So for example, with the Coumadin or warfarin example, we have to pay attention to their INR levels, right? And usually when we're giving that to them every day in an acute care-like setting, that INR level has to be monitored daily. All right. So these are examples of things that you need to be aware of when it comes to pharmacological therapies. Then the next one, okay. And if this is helping you, please let me know by leaving a comment or a thumbs up on the video, etc. All right. Then the next thing is pharmacokinetics. All right. Pharmacokinetics. If you can describe for me in the chat what you think pharmacokinetics is, go ahead and put it right now. All right. If you believe you have an understanding of pharmacokinetics, comment below and let me know if you understand what it is. So pharmacokinetics, pharmacokinetics refers to the study of how drugs move through the body. It encompasses 4 essential processes: absorption, distribution, metabolism, and excretion. One more time, pharmacokinetics refers to the study of how drugs move through the body. It encompasses 4 essential processes: absorption, distribution, metabolism, and excretion. All right, those are the 4 main elements behind it. So here's one of the things about this, because sometimes we'll learn stuff, but we don't understand how it's actually applied in real life. And your understanding of pharmacokinetics is really, really important, because if you don't understand it, then and how we implement it and the safety behind it, then you're going to struggle with pharmacology and pharmacology-like questions. So you need to know this, because the way that a drug goes through the body, that influences why we give them the drug in PO form by mouth, in IV form through the IV, right? IV push or IV piggyback, in sub-Q, right, through their fatty tissue, or IM in the muscle. So understanding that is so important, because especially depending on the nature of the drug, if you give a specific type of drug in a specific route, then the effect of that drug is going to work a lot faster, and it's going to be a lot more potent. That's why you can cause a med error. That's why if you give a drug, if you don't really pay attention to that route, that's why a patient can have an adverse effect or a life-threatening effect or potentially die, because it matters the route. So for example, insulin, right? Insulin is supposed to be given subcutaneously, right? Through the fatty tissue, and usually we give it in their stomach and etc. And then it works. Relatively, it works within about 15 to 30 minutes, and the peak varies whether it's like Humulin R or MPH and etc. Right? So 15 to 30 minutes, 30 to 45 minutes, it varies depending on which type of insulin, right? So, but the thing about it, and usually we give it because the patient's blood sugar is elevated, right? So if you was to give, let's say it's 10 units of insulin. If you was to give that same insulin through, for example, an IV line versus in their stomach, in their fatty tissue, it's going to work within minutes, like within like a couple of minutes or less. And it could cause the patient's blood sugar to drop rapidly, which would cause a very severe hypoglycemic effect. That's why we don't that's why it's not a light thin, oh, just give it PO, oh, just give it IM, oh, it's okay, give it sub-Q. No, it is significantly important which type of route you're going to give the medication through, right? So you need to be aware of that. And that's what pharmacokinetics is. That's the movement, the distribution, the absorption, the metabolism, and the excretion of the drug through the patient's body. Hey there, this is Nurse Chioma. Do you need help to pass your NCLEX exam, especially your RN test, and maybe you're nervous about it when it comes to passing the exam, taking it with the next gen test, and maybe you tried it before and haven't been successful? I want to invite you to attend my upcoming 6-week NCLEX RN review. This is going to be a great virtual online review class for the next 6 weeks, where I'm going to show you how to take and pass your NCLEX exam. During this review, we're going to go over content. I'm going to show you how to think more critically. I'm going to teach you and help you to realize why you may not be passing your exam, especially if you've been struggling before. In addition to that, while you're a part of this program, you also get access to an online library, and in that online library, this is where you're going to get more content, review, as well as also assessments and practice questions and next generation like questions as well, so that way you can further boost your confidence to taking your exam. So this is inclusive for everybody that attends the class, all right? You're also going to get homework as well. It's going to be a great opportunity so you can really feel confident. And the great thing about what I do, I've been doing this now for several years, since 2015, and we've seen a lot of amazing, successful stories of people who have finally passed their NCLEX exam after struggling before, people that felt unconfident, people that were nervous to make an investment, but they made the investment, and now they are living their dreams as a registered nurse. So if that sounds like you, go ahead and click below and register right now, so that way you can be a part of this amazing live training where you're going to learn how to pass your exam, so that way you can go on and live the career that you desire to live. All right, see you in the class. Wow, so what did you guys think about today's video? I hope that you found it interesting, informative, educational. If you did, Comment below. Let me know what your thoughts are on today's video. I would love to hear more from you. And also as well, make sure you hit the like button because it helps the video to get pushed out in the algorithm. And if you want to check out our resources, we do have special resources. If you're right now trying to pass your nursing boards, your NCLEX exam, you can attend our live classes, or you can sign up for one-on-one tutoring if that's something that you feel like will really help you, especially if you've been out of school for a long time. We do also have resources for those of you that are international students. And then overall, if you just want to get access to some of our books, digital notes, study kits, things like that, all of that is available below this video. All right. So thank you so much. Go ahead and hit the subscribe button, and I'll see you guys in the next video.